Hi, everyone. Thanks for joining me today. I've got a good topic for you. It's going to be sex after pregnancy and when can you have sex with your partner? But before I jump into this topic for today, I want to thank you all for subscribing. And if you're new to my channel, thanks for being here. This is a place where we talk everything about relationships, how to go deeper with partners, friends, family, boundaries, communication, intimacy, all the good stuff, how to have stronger, more success in relationships. So if you're wanting to improve your bonds, your connections, your relationships, you want relationship, you struggle in relationship, this is the place to be where you're going to learn all sorts of tools, skills, and I guide you. I love sharing all that I learn in my work with clients one-on-one, in the courses that I've taken throughout the years, continue to take courses. Like right now, I'm in a level 1 in IFS training, and I look forward to actually going all the way through into level 3. I'm incorporating it into my practice. So I'm able to impart so much knowledge and share it all with you. And you can take bits and pieces, all of it, some of it, none of it, whatever works for you. But I'm just here to support and offer information, knowledge, wisdom, and so on. I can't, it's a waste if I just use it in my life. I'm not able to share it with y'all. So yeah, thanks for being here. Subscribe, share, comment. I love to respond to your comments. You have any questions, please post. I try to respond to those too, all of it. So thank you. Thank you. So let's jump into today's topic, sex after pregnancy. When can you have sex with your partner? Pregnancy and birth are incredibly intense life experiences that deeply impact many parts of our life, our emotional and psychological landscape, our relationships with our bodies, our overall health, and even our relationships with our partner. Squarely at the overlap, all of these concerns is our sex life. The question of what sex looks like and when you can have it after giving birth is often opaque and mysterious. You may feel completely at a loss around this important part of your life and well-being. And today I want to share about how to go about sex after pregnancy. Understanding the timeline for postpartum sex. When to have sex again after pregnancy is a personal decision and may vary widely for different people. The risk of developing a postpartum health concern is the highest for the first 2 weeks after delivery. So it may be wise to focus on recovery during that time. Clinicians generally recommend waiting 4 to 6 weeks to have sex, depending on your body, your birth experience, and the types of sex you want to have. You may have a different experience. In terms of navigating your own readiness, remember that it's best to wait until any vaginal tears have healed for penetrative sex, bleeding has stopped, you've had at least one appointment with your medical provider post-delivery. There are a few physical postpartum outcomes that may make sex feel different or challenging, even if you aren't medically contraindicated from having it, including unusual discharge, vaginal dryness, related to hormone changes, and lingering pain or discomfort. If you've had an episiotomy or developed any scar tissue from tears in the vaginal canal during delivery, those might also cause discomfort or soreness during sex. If you're breastfeeding, that may also cause pain, soreness, or discomfort. Even if you've had a C-section, sex may be difficult as you recover from major abdominal surgery. It's a good idea to ease back into having sex and go slowly with a lot of communication. Remember, your body has been through a major event that involved every biological system, and give yourself some grace if you don't feel normal instantaneously. It's possible that some aspects of your sexual experience may change as a result of the postpartum changes to your body. Once you feel physically able to, Kegel exercises can recover some of the pelvic floor muscle function and tone that may have changed. And feel free to go back to previous videos where I cover more details about pelvic floor and Kegel exercises and so on. Next, managing emotional changes, mental health, and fatigue. Being physically ready for sex is one thing. Being emotionally ready is another. Even if you don't experience postpartum depression, which affects up to 1 in 10 women who give birth, delivery is an intense emotional and psychological process, as is having a newborn. You're likely also fatigued and stressed, even with abundant community and family support, which not all of us have. I mean, I certainly didn't. Caring for a newborn while recovering from delivery is labor-intensive and draining. As you consider whether you're ready to have sex again postpartum, one great way to reestablish intimacy is by sharing as much of the emotional, psychological, and caretaking load as possible. It's difficult to feel romantic or sexy when you're sleep deprived and emotionally fragile. Feeling cared for, seen, and supported is a good first step. And also, let's not forget about like eating and nutrition. At that point, you're just like trying to keep everything functioning, right? You're not eating well and, like it's not sleeping well, totally stressed, right? Make sure to keep all of that, take it all into consideration. Small steps to rebuilding connection. It may be some time before vaginal penetration sounds or feels good. And it's a good thing vaginal penetration isn't the only way to feel intimate or sexually connected to somebody. Some other ways for you and your partner to connect with each other in the meantime may be sensual or postpartum massage, mutual masturbation, oral sex, sexting, or sharing fantasies with each other. It's also possible that exhaustion, breastfeeding, or other needs of the babies that have you feeling like just touched out, right? And even non-penetrative physical intimacy doesn't sound good. Talk with your partner about other ways you can feel reconnected emotionally and psychologically, even if it's just spending time alone together while someone else cares for the baby for a few hours, or creating some specific rituals and routines to share with each other, even if your schedules now feel really different. Every day is a different post-birth. Your day-to-day life and your reactions to it are all in flux. How you feel one day isn't necessarily how you're going to feel the next day. Try to keep up with open communication as much as possible and share how you're both feeling, both in your life and in your relationship. It's possible that your body and the sensations it experiences may feel very different postpartum. Try masturbating and noticing what feels different or the same, and letting your partner know what feels good to your body in its new postpartum state. Maintaining openness with your partner about how you're recovering and how your body feels helps them know how to support you and helps both of you know what to expect with sex and intimacy. When to seek help, addressing postpartum depression or pain. Sometimes the idea of having sex ever again feels impossible because everything feels impossible and insurmountable. If you're experiencing new anxiety, crying spells, volatile mood swings, or irritability, feelings of worthlessness or shame, obsessive thoughts, paranoia, or thoughts of harming yourself or the baby, it's crucial that you talk to a healthcare professional. You may be experiencing postpartum depression, and it's something not to take lightly. It's serious. Some pain with penetrative sex postpartum can be normal. It's a great idea to go slow and use lots of lube and foreplay, more than you might have before. It's possible that you may need different kinds of sensation than you did prior to giving birth, at least for a while. If it doesn't feel like sex is getting any less painful over time, or if you're still experiencing pain more than 6 months postpartum, it's a good idea to see a doctor. Pelvic floor physiotherapy can be an important intervention for having a full and pleasurable sex life postpartum, rehabilitating the muscles that were stressed during childbirth. So that's what I got for you today, folks. Thank you for being here with me. And I will see y'all next week. Take really good care of yourselves, especially today. There's so much going on in the world. Spread love, kindness, and maintain as much positivity as possible. Kisses, hugs. I'll see you next time.